So what is the risk assessment that CARFA has given based on the risk assessment tool that I told you that was created and discussed with our partners? Currently, despite WHO giving a global risk of high, for the region of the Caribbean, it's currently low from the perspective of disease importation, but vigilance is required. The situation is changing quite rapidly. One of the biggest risks to the region is the social media misinformation, which is a risk to the stable profile of the Caribbean. And one of the things we are working with our partners, CTO and CHTA, to try to avoid is negatively affecting tourism because of a negative portrayal of the health response of the region. So CARFA's role is to support its member states in adapting existing influenza preparedness plans to adapt to the novel coronavirus, the training and refreshing of training of healthcare workers in universal precautions, and the use of necessary personal protective equipment to ensure that our very important healthcare workers are protected, and the implementation and supporting measures to protect the most vulnerable in our populations from developing disease and trying to avoid unnecessary death. So let me give you an idea of some of the myths and misinformation that have been circulating in the Caribbean and creating panic and some rather strange responses. And on the left, I wanted to show you an actual example and what these myth purveyors have done is that they found formats that look authentic and then they intersperse conspiracy theories, misinformation, fake news with some facts. So it looks credible and it increases the fear of persons. Prevention method is to keep your throat moist. Thus, do not hold your thirst till the end of March. Do not go to crowded places. Wear masks. So I understand that there are some countries where there have been runs on masks. Avoid fried or spicy food and load up with vitamin C. And the virus causing it is very potent and is resistant to existing antibiotics. So for persons who are not trained, who would understand that an antibiotic doesn't work against a virus in the first case, these kinds of things cause fear and strange behaviors. So the CARFA Communications team has been actively working and engaging key stakeholders and providing them with accurate, relevant, and timely information through convening and participating in response coordination meetings with key stakeholders, including the Regional Health Communication Network, which has focal points in all of our 26 member states, responding to the communication needs of CARFA member states by providing daily situation reports and sharing communication messages and materials to communication focal points via regular and social media, providing information knowledge that is relevant and easily accessible through the CARFA website, and providing technical support, including templates and guidelines for developing communications plans and strategies during a public health emergency or outbreak. So this is a hoax video that has been gaining quite a bit of traction. In the interest of time, I won't hit the link, but really it's a rather interesting video that I hope you can watch later.
Right now, when I can stop it, the coronavirus released in Trinidad and Tobago by 5 Chinese nationals.
I hope you heard that, CMO. And here is another joke to show you how extreme things are. The Corona bear is being shunned by the Heineken beer. But I found out that some people have actually started to believe that the beer is the cause of the novel coronavirus. The level of misinformation is off the charts.